Stay with that story and look at the fate of universal healthcare in the country. Remember, this is one of the big four agendas by President Uhuru Kenyatta. We'll be speaking to Seth Panyako, who is the Secretary General of the Kenya National Union of Nurses, joining us live from Kisumu. Mr. Panyako, many thanks for your time this morning. Now, governors hold that devolving healthcare has seen a remarkable improvement in the health system in the country. Do you hold the same view?
I do not hold the same thing, because when we talk of universal health coverage, it is supposed to mean that every Kenyan and every corner of this country is receiving equal access to healthcare services, just like whether you are in Turkana, whether you are in Kirinyaga, whether you are in Kisumu. Universal healthcare coverage means you must be receiving adequate, accessible healthcare services at every corner of this country. What are we saying today? Do we have health services going on in Kirinyaga today? The answer is no. Why? Because devolution of healthcare services was done politically and it has miserably failed. We will not forget to appreciate some counties that have done so well in terms of improvement of healthcare services, but we cannot isolatively use a few counties like Makueni and Machakos, which I keep on referring to as good examples that have done so well in the management of healthcare sector to mean that devolution of health sector has been successful. I want to correct the notion and some governors who believe that health workers want health facilities to go back to the national government. That is not the position of the health workers. Indeed, this morning, I have listened to the speech by CC for Health for Kisumu. I have also listened to the speech by Honorable Governor Nyang' for Kisumu, and he has come out very clearly saying he supports the establishment of the Health Service Commission and not the Health Employment Commission. What we want is to have an independent body away from the national government and away from the county government that is going to be responsible for the management of the healthcare system in Kenya, just like the Teacher Service Commission. So it should be molded alongside the Teacher Service Commission, so that the budget for healthcare system in Kenya goes directly to the Health Service Commission, which will then be able to distribute this money to all health facilities in Kenya, as opposed to today. Like I keep on giving an example of my own county where I come from, Kakamega, where they are given conditional grant for level 5 hospital of 416 million in the last financial year, and the county government finds it fit to give level 5 16 million. When you ask them where the 400 million go, they will not be able to tell you. I asked this question to Governor Paranya when he appeared with me on KTN, the big story, the other day, and he could not answer. So we want a body that is charged with the responsibility of managing everything about health. In fact, the Health Service Commission that's going to be formed, because I think I have seen and I've heard Professor Nyong'o this morning supporting the establishment of the Health Service Commission, and in his own words he said not to establish the Health Employment Commission. We support him. We want the Health Service Commission that has the powers to ensure that every Kenyan at every level of this country receives equal, accessible, affordable, quality healthcare services. But the way things are today, each governor is doing what they want. They have in fact hijacked human resource for health. The governors are the one managing the county public service boards. We don't know where they are. They have no respect for the dignity of the health workers, and that is why you see when health workers have issues, some of them rush to the president, some of them rush to the courts, they criminalize labor matters. They have failed the issue of tripartite social dialogue in terms of management of human resource for health, and these are the issues that can be properly done by the Health Service Commission. All the finances, all the budget for health workers for health system should go through the Health Service Commission. We have even a radical proposal that the National Health Insurance Fund should be turned into a bank, so that you have the National Health Insurance Bank, so that the responsibility of the National Health Insurance Bank will be to receive the money and distribute the money. The issue of accreditation should be given to Health Oversight Authority. The issue of checking the quality and ensuring that what the hospitals are demanding to be paid can be given to another body. Even our union has branches across the country. We can help the government to ensure that what the institutions or the hospitals are asking is what services they have actually given to the citizens. So the way we are today with the National Health Insurance Fund, the way it is structured, and the universal health coverage, the way it is structured, it is bound to fail. The universal health coverage is not going to be sustainable in long run, because we need to know
saying the health workers do not want to be under the national government. They do not want to be under the county government. But have you forwarded these proposals to the Ministry of Health? And is there anything being done about these proposals, the establishment of a healthcare commission, for example?
I can tell you that the establishment of the Health Service Commission is being supported by 95% of all stakeholders within the health sector. Even I've told you this morning that Governor Nyong'o has made a presentation. He didn't tell us where the presentation went, but I suppose he made to Building Bridges Initiative, where he's proposing the formation of the Health Service Commission. The Ministry of Health is in support of this. Many counties, you had the governor for Narakanithi, who said that he wants to return the health sector to the national government. You had the governor for Nyeri, who has returned level 5 Lucy Kibaki referral hospital to national government. Those are signs that they are not able to handle this function because of the reason they are saying they are not given adequate funds. The issue of fighting for adequate funds to healthcare system cannot happen under the current system. We must have a body. When we fight for increased funding, we know that this funding is going to go straight to development of healthcare sector, not a situation where level 5 is given a conditional grant and the governors take that conditional grant to go and build toilets around, make roads and do politics with that money. So we want a body that will be charged with the responsibility of managing and protecting and ring-fencing the money for health sector.
That is Seth Panyako, the Secretary General of the Kenya National Union of Nurses.